Hello, my name is Helmut Schuehsler. I'm running for the board seat nominated by the investment managers for the next period. I have been an investor all my life. I entered the industry at the age of 27, and I've been making investments in various different parts of the healthcare industry. I've been involved in scientific discoveries and drug development, medical devices, and in the last 10 years, I focused very much on building healthcare infrastructure and providing high-quality healthcare to people in emerging markets. I'm currently the chairman and CEO of TVM Capital Healthcare. We are a growth capital and expansion capital company operating out of two hubs. One is Dubai in the United Arab Emirates, and one is Singapore. I have been a practitioner in this industry for all my professional life. I initially worked out of our offices in Munich, then Boston, where we covered the US market, especially US East Coast. Then I personally moved to Dubai in 2010 when we started TVM Capital Healthcare. And now in the last 2 years, we've been active in the Southeast Asian market. Because of this sort of huge spread of geography, I've seen a lot of issues in our industry, and I've seen a lot of things that can go right and that can go wrong. As part of my responsibility, I also decided in the early 2000s to give back and become engaged with the European Venture Capital Association, as it was called at the time, EFCA. I was elected the chairman of the Professional Standards Committee of EFCA, where we worked on things like the Code of Ethics or the IPEF valuation rules, and many industry guidance documents that addressed the question, how do LPs and GPs interact with each other, and how do GPs interact with companies, company management teams, and stakeholders. That led into my election as chairman of EFCA in 2007 and 2008. So I've been engaged with the association for quite some time, and I've gained tremendous experience both in interacting with other practitioners, but also forming task forces with auditors, with lawyers, with people who are generally engaged in our industry as stakeholders. I think this has prepared me very well for this task. Since inception of TVM Capital Healthcare in 2009, we've tried to apply a lot of what we've learned in Europe and in the US to our target markets. And there was a lot to do, to be honest. And when we talk about ESG today and impact, for us, it was really more like GSE, because governance for us was probably the most important aspect of our activity, followed by the social aspect of how we treat our employees, how we treat our stakeholders in our companies, how we treat the patients and the patients' families. These are all hugely important factors that all together and taken together and done well create tremendous impact in the communities that we serve. We've also focused a lot on healthcare services. In many parts of Asia and the Middle East, there is not a lot of good healthcare, high quality healthcare that people can actually access. And I think that this is a tremendously important part of the impact that we create in the countries where we're active. Over my 30 years in this industry, I have seen great science, I have seen great service concepts. We have been able to help lots of patients across the world. I personally believe that the movement that is behind ESG is tremendously important for this world and for the creation of sustainable businesses that have a truly impactful role in their societies. I have devoted the last 15, 20 years to focus on this aspect particularly. And we believe that continuing this is not a choice, it's a necessity. What I can do to help PRI to get to that point, I would be more than pleased to do. My major consideration is that governance and social and environmental management needs to be different in different parts of the world. Every country is in a different place. The peoples we are dealing with are different. They have different issues in their lives, in the economy. And I think we need to be cognizant of that. PRI is an international organization, and it needs to deal with the reality of the world around us. And that's true in the US, it's true in Germany or the UK, but it's also true in Vietnam and in the Philippines and in Saudi Arabia and Kuwait. That, if you will, I think should be my mandate. Thank you very much.